Welcome everyone to this webinar for the community-led Safe Spaces project that Roses in the Ocean is working on, and particularly about the expression of interest that's been released. So before we get underway, I do want to acknowledge the traditional owners of the lands and waters that we're all meeting on this evening, and pay my respects to the elders past, present and emerging, and also acknowledge the important contribution that Aboriginal and Torres Strait Islander people make to suicide prevention, and particularly acknowledge any Aboriginal and Torres Strait Islander people who are either on the webinar or are viewing this webinar in future as well. I would also like to firstly honour all people with lived experience of suicide as well. Many of you will be well aware that Roses in the Ocean is a lived experience of suicide organisation, and so of course people with lived experience of suicide are very much at the centre of everything that we do. And when we refer to people with lived experience of suicide, we're meaning this in a very broad and inclusive way. We refer to people who have gone through a suicidal crisis, who have made a suicide attempt, cared for someone through a suicidal crisis, or lost a loved one to suicide. Now, just a quick overview of what I'm going to cover. Firstly, just very briefly, a little bit of information on Roses in the Ocean, some key terms that will be used throughout the webinar, a bit of history and context for the development of safe spaces in Australia, some of the key information from the expression of interest, a little bit of extra information about how creatively we would encourage you to think about the idea of community-led safe spaces, and also some key considerations before submitting. And then, as I said, there will be time for questions and discussion afterwards. So just firstly, for those of you that aren't familiar with Roses in the Ocean, we're Australia's national organisation for people with lived experience of suicide. We were founded in 2011, so we're over a decade old now. This is our 11th year of operation. And we have a lead role in lived experience partnership, innovation and reform in suicide prevention in Australia. There's a wide range of work that we do, including a variety of community workshops, co-design of suicide prevention services. We have a new phone support service, a wide range of information resources, and we also do a lot of work across the policy, advocacy and research fields. And we're funded by the Commonwealth Government mainly, but we also receive some funding from a small number of the state governments, and we also generate some of our own funds as well. Now, I mentioned that I would go into some of these key terms. So when I mentioned lived experience earlier, just to repeat that definition, that we're talking about a broad category there of people who have experienced suicidal crisis, survived a suicide attempt, cared for a loved one through a suicidal crisis, or been bereaved through suicide. I will be using this term non-clinical quite a lot, and what that means is that the service that we're talking about, or the model of the service we're talking about, does not involve doctors or nurses or psychologists or mental health assessments or any of those things that you would expect in a clinical service or a clinical mental health service. I will be using the term peer support a lot. We refer there to support that's provided by trained volunteers with lived experience of suicide. We use the term guests to refer to people seeking support at community-led safe spaces, rather than terms like clients or consumers or patients that you might more expect in a clinical setting. And I will refer to these groups in the community called working groups that consist of local volunteers who are working cooperatively to create a community-led safe space. So just a bit on the evolution of safe spaces. So as far as we understand, the genesis of this concept was in 2016 or around that time in the UK, where a new type of service called safe havens was created. These were non-clinical spaces, but very much in the community, and they were found to reduce admissions to mental health services or mental health inpatient units in their catchments by 30%. So a really dramatic difference was seen in the locations where these safe havens were in place. In 2018, the safe haven concept started in Australia at the St Vincent's Hospital in Melbourne. And this was a non-clinical space within a hospital, so about 100 metres from the emergency department, but was designed to divert people from the emergency department who were experiencing suicidal thinking, with the safe haven a much more appropriate space for them. A similar service was piloted in Redland in Queensland in 2019. And then in 2020, there was a large investment in New South Wales for safe spaces. And these were delivered through the mental health system, providing alternatives to emergency departments. Again, very much related to the hospital system and diverting people away from emergency departments. Now, over the last couple of years, we've seen more of these non-clinical safe spaces start in Tasmania and other parts of Queensland and New South Wales. Sometimes it's been state governments, sometimes it's been primary health networks and others that have been supporting those spaces opening. And now, finally, in 2022, we have the National Community-Led Safe Spaces Project, with a very much community-based model, which is delivering safe spaces that are owned by local communities and are delivered outside of the mental health system. If I could just encourage anyone who has joined recently just to mute your Teams system using the microphone icon in the upper right-hand corner. Thanks, everyone. So, building on all of that history I just mentioned, what are community-led safe spaces in the context of this new national project? They are volunteer-run, non-clinical services where people experiencing emotional or suicidal distress can find compassionate and empathetic support from workers who have also gone through their own suicidal crisis or have lived experience of suicidal distress and have been trained to use their lived experience to support others. And so what Roses in the Ocean is trying to do with this national project is provide an opportunity for local communities to create their own community-based service for people who are experiencing suicidal distress. Just to build on that a little bit more, these are, of course, non-clinical environments. They provide emotional and practical support rather than counselling or medication or doctor's appointments or any of those things that you would normally see in a clinical service. They're run by volunteers, as I mentioned, and these are trained peer volunteers. And just to expand on who they are, they're people with lived experience of suicide, and we particularly believe in the benefit of what peer volunteers can provide, because they know that they relate to the experience of the people who are using the safe space, and the people using the safe space can know that they'll always be speaking to someone who understands and relates to the distress that they're experiencing. We have a kind of a strong position, I guess, that there's no exclusion criteria or eligibility restrictions, so everyone who needs the safe space can access it. And importantly as well, that it's available after hours. So they're intended to be available outside of the usual business hours when many other services are available. This is a diagram that, for those of you who have had a chance to look at the expression of interest, would have already seen. Through a number of years of co-design of these types of services now, Roses in the Ocean has developed this set of 7 components or 7 elements of a safe space. And they include, just going from the upper right-hand corner there, a trauma-informed or no wrong door approach that relates to the point I mentioned in the last slide about there not being eligibility criteria or reasons that people would be excluded from accessing the support at the safe space. As I've mentioned, there are non-clinical services that aim to meet the holistic needs of guests. So, not just relieving symptoms or, reaching a diagnosis, but to really look at everything that is distressing the guest and working with them to address those needs. To provide compassionate and capable peer-led workforces in each of these safe spaces, to provide a safe and accessible location, a warm and welcoming environment, and warm connections to appropriate and reliable support. That might be a whole range of other local services that the person in distress may require. That could be financial support, it could be legal assistance, it could be relationship advice or relationship counselling. It could be a clinical mental health service as well. So there's a pathway for people who are accessing the safe space into a whole range of other support that can assist them. And lastly, that there is shared governance and management, and I'll refer a bit more to what I mean by that term in the next couple of slides. So I mentioned that Roses in the Ocean is inviting local working groups to contact us and make a submission through this expression of interest. There's a whole range of ways, as you can see on this slide, that Roses in the Ocean will be assisting those working groups. And that includes a grant of $20,000 per year to support the operation of the community-led safe space for the life of the project. We have currently 3 years of funding for this that has only just started as of the new financial year we've just entered. So that's $20,000 per year for each of those 3 years that's available. A memorandum of understanding between us and the working group that will set out everybody's roles and responsibilities so that everybody's clear on who is contributing what. An auspice of working groups for insurance purposes for 2 years. Should they require that? It may be that some working groups don't need that auspicing. You may have access to insurance through other local services, for example, but we can provide that if it's needed. Facilitation of local co-design of the community-led safe space, and facilitation of what we call peer care companion training for the first 10 volunteers as well. So that's provided free of charge. access to free or low-cost suicide prevention training, in particular the ASSIST model from LivingWorks for volunteers and working group members. We have prepared detailed operational guidelines for working groups and volunteers that are running the community-led safe space. We provide a fortnightly working group mentoring session for all of the members of the local working group, a monthly online community of practice that links together all of the working groups nationally, group co-reflections for the volunteers who are actually staffing the space, and also access to an online volunteer rostering platform called Volaby that you can use to help with your local rostering. So there's a wide range of support that's being provided by Roses in the Ocean through this project. Now, I wanted to talk just briefly about the assessment criteria as well. These are set out in the expression of interest document that's available through the website. There's 5 criteria that we will be looking for when we assess these submissions. Firstly, that the proposed working group has a sufficient number of members, a good mix of skills, and is likely to operate cooperatively and democratically. This is speaking to that earlier point that I mentioned regarding shared governance and management. We do want these working groups to operate in a cohesive and collaborative way with plenty of opportunity for inclusion and participation of all of the members. Secondly, that the proposed working group has strong links to their local suicide prevention network or suicide prevention collaborative, or if there is not a network or collaborative in your area, other suicide prevention services that might be located in your area. Thirdly, that there are enough potential volunteers identified who are willing to work in the community-led safe space during the proposed hours of operation. And this is actually quite an important point because we have had some pilots of the community-led safe spaces opening this year around the country. And we've learned a lot from that experience, including that the people who are forming the local working groups to get the community-led safe space up and running aren't necessarily the same people that would be volunteering in the space. Some of them want to have more of that organisational role in the background, but don't feel confident or don't particularly want to be a volunteer in the safe space. So that's an important distinction to bear in mind, that if your working group contains members that are wanting to work on the coordination and management of the project, but aren't the right people for volunteering in your community-led safe space, then it's certainly necessary to enter the project with a sense that you will have enough of those potential volunteers ready to staff the space when it's up and running. Fourth, that an appropriate likely venue has been identified, and again we've noticed that this is, as you'd expect, a really key issue. Although we're not expecting that working groups or people in local communities would submit an expression of interest with a venue, absolutely signed on, we don't think that's realistic, but we would like it if you could come to the expression of interest with a couple of options or some idea of what your likely venue might be. And lastly, that there is a range of supportive local resources and services that have already been identified, so that guests of the service can be easily connected with the other help they'll need. And again, we've noticed that that's a piece of work that can easily be done in advance, and it is important that that be done prior to the to the community-led safe space opening, so that anyone entering the space can be, directly linked up with the other forms of local support that they might need. I just wanted to have a quick word as well about, I guess, the invitation to think really creatively about a community-led safe space for you and your community as well. We have termed this idea in the first dot point there as pop-up community-led safe spaces. Now, rather than a kind of a bricks and mortar building, this could be a community-led safe space that pops up at regular events like markets or fairs or community events. And if that's something that you would like to propose rather than a community-led safe space that's in the same building or room every time it's open, then we'd be really open to considering that. Next, we are also welcoming the idea of there being community-led safe spaces for particular groups, if that's a direction you'd like to take, such as young people, Aboriginal communities, LGBTI communities. There's a whole range of communities where, depending on your local environment, it might make sense to particularly focus your community-led safe space on one of those communities. We have had a couple of questions already about the potential for an online community-led safe space to be considered. So very open to talking further about that as well. I think that is, of course, a very new and innovative way of thinking about a community-led safe space. So if you are thinking about the online space as being an area you'd like to focus on, then we would really welcome that as well. So please contact me to discuss any ideas you might have about a community-led safe space for your area or community. Now, just lastly, some key considerations before you submit your expression of interest. And a lot of these are similar to the criteria that I mentioned earlier. A working group of local volunteers that have a good mix of skills and can work together in a collaborative and democratic way is really absolutely essential. So certainly please think about that and ensure that you have got that in place as much as possible. I mentioned earlier this potential pitfall around not having a number of volunteers identified who are willing to receive training and then go ahead to work in the community-led safe space during its proposed operating hours. So again, that's really something to think about in advance of submitting. Some initial scoping of locations that you think could work as a community-led safe space would be highly desirable, and would also be excellent if there were some early indications that you would be permitted to use the location for the safe space. And just lastly, some pre-existing awareness of the other services and resources in your community that you could tap into to connect people who would need those services to address the cause of their distress. And I mentioned some of those earlier as well. Now, just lastly, the submission details are as follows. The deadline is close of business on 30th of October 2022. We have left a period of a few months for this, particularly so that there's ample time for local communities and local working groups to attend to some of those issues that I've mentioned in the last slide. If you haven't seen the expression of interest form, it's available there at the Roses in the Ocean website at that address, and you can contact me by my phone number or my email address there at any time to talk about your ideas or talk about any questions or concerns that you might have about your expression of interest.